So let me tell you a little bit about Dr. Michael Rose. He's our speaker for tonight. Dr. Michael Rose is one of the world's leading scientists in aging, biological immortality, and human evolution. He is director and professor at the Department of Ecology and Evolutionary Biology at the University of California, Irvine. He has been doing research for 40 years and published over 275 academic publications and authored 10 books, including Does Aging Stop? And the Evolutionary Biology of Aging. So we know this guy. I'm excited to hear this talk tonight. So please give a warm welcome to Dr. Michael Rose.
Hello. Am I audible? I'm audible. Outstanding. Okay, now for the hard part. Let's see if I can do a screen share. And there. And let me get slideshow. Am I in slideshow, Mariana? Oh, now I am. Excellent. Okay. So those of you who heard me speak in 2017 at the RADFest that summer, you've already been exposed to the 4 steps on the road to biological immortality. It's based on a paper, which those of you who are into academic publications, it was called 4 Steps Toward the Control of Aging, following the example of infectious disease, published in Biogerontology, volume 17. What could be more exciting than that? But for those of you who don't like to get deep into the nerd verse, I'm going to try to give you a relatively appealing introduction to what we're just starting to do this decade and what will dominate this decade, which is step 3 of my 4 steps. So, which steps, dude? These are the 4 steps that I stole from basically 150 years worth of work, where we went from 1840, when the majority of physicians still believed in something called the miasma theory of infection, which they got from more than 2,000 years earlier, to 1990, around the time when we basically were on the road to defeating HIV and controlling it. This radical first scientific and then medical revolution gave us the world we live in today with 8 billion people. And we went from infant and young child mortality rates of around 50% before the age of 5 years to very small numbers of young children dying. What were those 4 steps, you might ask? Well, the most important first step was to realize that the basic science that had to underlie our approach to treating diseases like malaria, typhus, influenza, pneumonia, had to come from microbiology, a scientific field that had been in existence for about 2 centuries before physicians were even willing to consider it. So this is the world of things like bacteria and viruses.
Michael, we missed the first part of this when you just started talking about this slide.
I'm sorry.
Yeah,
Did the sound cut out?
Yeah, it was our glitch, but it's fixed now. So can you just take us to the top of this?
Sure. So, so the 4 steps, there are 4 steps that I stole from the medical revolution that happened from 1840 to 1990 that squelched infectious disease, which was the overwhelming cause of death and disability all through the 19th century. and progressively in the 20th century gave us a world dominated by hygiene, vaccines, antibiotics, antivirals, and greatly increased life expectancies. And here are those 4 steps. The first one was getting the physicians to accept that microbiology was the key science behind this reform or this revolution in medicine. Microbiology basically means realizing that all these little living things that you don't see with the naked eye, like bacteria. And that was a war primarily fought by people like Louis Pasteur. The second step, which followed very fast from that scientific victory, was a change in lifestyles. So believe it or not, before the victory of microbiology, the idea of washing your hands a lot, boiling water that might be contaminated, pasteurizing food, cleanliness, hygiene, those things were weird in the world of 1840. Those were not normal things. There might be a few exceptional people who did those things, but the microbiology revolution made those things normal. And now, I hope, we're all quite committed to lifestyles where we wash our hands, where we have clean food, we wash our food, we cook our food, we do all these things to avoid the spread of microbes. Okay? Again, unbelievably not normal in the world of 1840. The third thing that happened, following fairly fast on the shift in lifestyles, were early changes in medical practice. A huge one was just sterilizing operating theaters. Because believe it or not, before Louis Pasteur talked to Dr. Lister, the idea of having sterile operations where you cut open bodies was simply not done. Another early medical practice, the change was vaccination, for example. And those were the first sort of the frontiers of the reform of medicine, when the physicians finally stopped resisting the microbial revolution. And then by the middle of the 20th century, with the advent of safe and effective antibiotics like penicillin, we really got going on the modern war of infectious disease and pushing it down to become a relatively minor part of our lives, pandemics accepted, and living lives which were not cut short at any age by an acute infection. So that was the scientific and then medical revolution that created the world that we know and most of us appreciate. And in 2016, in an academic article, I proposed that we do the same thing for aging, and that in many ways we had to recapitulate the entire first scientific and then medical revolution in order to achieve lives where aging is a very rare or unusual cause of death, and we get to lead indefinite lifespans. Okay? And I'm just going to briefly go over the whole 4 steps before I focus on step 3, which is my main concern. So what are those 4 steps stolen, quite unimaginatively by me, from the microbiological revolution? As always, a really radical medical revolution requires a scientific revolution. And like microbiology, an unpopular field of biology in the early 19th century, like the 1840s, a relatively unpopular field in biology supplies us with the basic science that we need to consummate this revolution. And that science is evolutionary biology, not cell molecular biology. Even though the National Institute on Aging is founded on the premise that cell molecular biology is in fact the key to aging. People in my field have been arguing since 1941 that it's our field that is the key field that will drive the scientific revolution. Secondly, that just as with the microbiological revolution, you should change your lifestyle in accordance with the real science of aging. And that means ancestral diets that make sense in terms of your particular ancestry and your age, that you should exercise, stay active, and find your tribe. And you guys know way more about finding your tribe than I did before I ever met you. Thirdly, which is today's focus, early medical shifts. So what are the first things you can do once you're good with the basic science, once you've started to adapt your lifestyle? And then after those medical shifts that will primarily take place over this decade, we will then be able to start a full-blown war against aging, get on the road to biological immortality, and just totally revolutionize human life expectancy for a second time. And, you know, a minimal goal would be doubling our lifespan relatively soon. But, you know, I place no limits on this. This is a limit to my point of view as an evolutionary biologist who's worked on biological immortality for 30 years, is that we're going to get really wonderful biological immortality once we get to step 4. But right now, we're stuck with earlier steps. Now, I've talked previously about the scientific war between evolutionary biology and cell molecular reductionism, which is step 1, where I get to do my evolutionary biologist version of Louis Pasteur. And I have been doing this since 1976. It's approaching 50 years. And right now, together with my graduate student, Kenneth Arnold, we're finishing a book which basically lays the whole thing out, the entire war, which has proceeded for about 80 years between our standpoint on aging and their standpoint on aging. I'm not going to say anything more about it today. I have a website. I have yet another book on this. I have hundreds of articles on this, and I'm just done with the scientific war. If you would like to die for reductionism, I can't stand in your way. And I published an article a few years ago asking, are you willing to die for reductionism? And unfortunately, I still have friends who are happy to die for reductionism. I have never had any interest in doing that. I hope very few of you are still willing to do that. And you've heard me talk about step 2, lifestyles, on probably at least one occasion. I've done it at RadFest. I've done it to you guys and People Unlimited. And that's lifestyles, which can basically be summarized as going back in our evolutionary time as you go forward in your chronological age. When you're a young person, if you have Eurasian ancestry, then you can eat agricultural foods because you have lots of agricultural ancestry. But as you get older, you got to shift to pre-agricultural diets and lifestyles, chronic activity, but not Olympic athlete levels of activity. Find tribe, people who will support you in your commitment to, in my case and your case, immortality, and so on. That's not what I'm going to talk about today either. What we need to do to talk about now is this decade, step 3. And step 3 is very specifically about our relationship with medicine, practice of medicine, the people who practice it, physicians, for example, given our commitment to immortalism, where, as you know, I believe immortalism is scientifically well-founded when you start from the evolutionary biology of aging and immortality. And I'll just briefly say, and I'll talk more about it later, within the modern evolutionary biology of aging, biological immortality is just a fact and no big deal. And we'll talk more about that as we go. So what I've done is I have developed a series of contrasts between the beliefs and practices and confines, sort of mental prison that afflicts sad physicians. And sad physicians are the physicians who deal with patients who overwhelmingly consume the standard American diet. This is the Pepsi and Cheetos, vodka and Red Bull, Twinkies, and it goes on and on, other kinds of trans fat laden baked goods. And overwhelmingly, the practice of primary medical care revolves around infectious disease and the effects of the standard American diet. And of course, you guys have been getting a crash course in infectious disease over the last 3 years. We don't need to talk about that. Okay. So in red, I'm going to be showing you what your sad physician believes and does and wants you to believe and do. And then in green, I'm going to show you what you really need to understand, to implement, to benefit from step 3 in the ongoing revolution that will take us to biological immortality. And as this slide suggests, this revolution is going to be founded in data, okay? A fecal ton of data. That is the foundation of what we're going to be doing. And that is what, in some way, directly or indirectly, intuitively, or in a very hands-on way, you're going to be dealing with. And I am basically going to try to introduce to you only in words, only intuitively, what you're looking at with respect to the breaking frontier of the immortality revolution. Ready? Off we go. So this is what your sad physician believes. Your sad physician is confronted with the sad reality that most of their patients will be eating the standard American diet, and they're already overweight, and they're on the road to type 2 diabetes, various kinds of cardiovascular disease, dementia, often depression, severe or low grade, and that as their patients get older and these lifestyle fostered diseases get sufficiently severe, your sad physician will treat those diseases one by one using medications that in many cases will only mitigate symptoms or partially mitigate some of what they call pathogenic processes, or you can think of as disease-causing processes. So the standard version of this is you have patients who, for example, their insulin production is insufficient or they're not responsive enough to insulin. The old school treatment, of course, for diabetes was simply providing insulin. Very straightforward and, for some people, effective way to deal with the problem of diabetes. But for most of us, it's not type 1 fully insulin dependent diabetes. It's type 2 diabetes, where you're in what's called insulin resistant. And I'm not going to go into the details of that. Many of you have already had conversations with your physicians about your being pre-diabetic or in the early stages of type 2 diabetes. And there are medications that will slow the progression of that disease, but not stop it. The same thing is true, for example, with a standard kind of cardiovascular disease, which is hypertension or high blood pressure. There are medications that can lower high blood pressure. A lot of people are become depressed in no small part because of all the things that are generated by the standard American diet, like brain inflammation. And if you're depressed, your sad physician may well give you an antidepressant, which for some people will make them feel better. And I'm not saying that those medications should be abolished. Instead, we have a different point of view. The best treatment for most metabolic disorders, especially the ones that are generated by the standard American diet, is to get off the goddamn standard American diet. Rebel against the supermarkets. If you see a food product advertised during a Super Bowl, don't eat it. Okay? If they're perfectly happy to give you unlimited quantities of soda at your neighborhood fast food restaurant, high fructose corn syrup sweetened soda, don't drink it. If it's artificially sweetened, don't drink it. In fact, if it's any kind of soda, don't drink it. Okay? You're just poisoning yourselves. More surreptitiously, the same things are true of any prepackaged food, like Twinkies, that is full of trans fats. Trans fats will destroy your cardiovascular health. The best approach to dealing with all the diseases generated or exacerbated by the standard American diet is not to consume the goddamn standard American diet. Get on the right diet for your age and ancestry. If your ancestry is entirely from sub-Saharan Africa or Australasia, don't ever eat any agricultural foods. You're not adapted to them. People from Eurasia are pretty well adapted to those foods until you're in your 40s. Then, unfortunately, you have to say goodbye to them. And you have to start going back in time and dropping even what would have been healthy organic agricultural products for yourself when you were 25 years old. Unfortunately, age matters. If you really want to get to the immortality level and you're over 40, you've got to say goodbye to all kinds of delicious foods. I used to love them too, okay? This is, of course, your step 2 intervention. But remember, this is not where your physician comes from. Your physician is going to implicitly assume that you will be eating crap, that you will become obese, type 2 diabetic, chronically depressed, potentially demented, with worsening blood pressure, increasing risk of heart disease and stroke because of the completely nasty diet that almost all their patients consume. You cannot blame them for this. It's like, as Dr. House used to say, everybody lies. Not everybody lies, but it's a useful working assumption in medicine. And the useful working assumption for your sad physician is their patients are sad too. Their patients are poisoning themselves with their mouths, one swig of a big gulp soda from 7-Eleven at a time. Okay? It's just like washing your hands. Drinking the big gulp soda is like never washing your hands. How well do you think that's going to work out for you? Hello? Food poisoning, it goes on. All kinds of infections. But that's what your physician is going to assume. Now we're going to get, I think, really close to the bone for People Unlimited. Your sad physician believes that aging is an inevitable cumulative process. And the idea of something like biological immortality is hopeless, meaningless, and not a worthwhile medical goal. This is really important. Basically, if you're over 50, the sad physician is going to assume you're going to be dead, okay, in a reasonably foreseeable period of time, and they're just sort of managing your exit. Because they regard us going down the drain as inevitable. They regard worsening of your metabolic health, your cardiovascular health, your brain health as inevitable and cumulative. They just don't know which is going to kill you first. That's the game they play. So, I mean, from an immortalist standpoint, you really have to understand how titanically counterproductive this is. The whole idea that you might be alive in 100 years' time, if you're over 40, to them is completely inconceivable. Okay? They cannot believe that. They cannot practice medicine in that context. So every time you talk to a normal physician, you're up against this prejudice, which is not scientifically true whatsoever, but is overwhelmingly the assumption of sad physicians. Okay? That you're right up against the wall. But here's what evolutionary biology tells you. Okay? You know, my research has been showing for more than 40 years, aging is radically modifiable. I have been extending lifespans since the 1970s by a lot. Now, admittedly, I was just doing that with fruit flies, but it makes the point. There's nothing about the cells or the molecules of life that requires aging proceeding all the way to death. In fact, some species absolutely never age. Biological immortality is a scientific fact. It's not one that your physician knows anything about, unless they used to be my student. And very importantly, the shift to a focus on immortality is the foundation of indefinite health, of sustained health. Okay? Now, in one sense, many of you already believe this emotionally. I've been coming and talking to you guys for 5 years to try to convince you that that emotional commitment of yours is well grounded in scientific facts. Unfortunately, scientific facts your sad physician does not know or accept. But once you realize the cogency, the centrality of biological immortality, then and only then can you start dealing with medicine and the way it's practiced as a hostile environment. It's not deliberately hostile. It's not like the Russian army in eastern Ukraine, but haplessly, just like physicians who would not wash their hands in the 1850s and 1860s, your physicians are setting you up for an early and very unappealing death. Okay? It's not that they're bad people. It's just they're taught by PhDs and MD PhDs in medical schools, all this other stuff, that aging is inevitable and cumulative, immortality is hopeless, and the best we can do is, for now, conventional medicine, and maybe someday rapamycin or polymerase activation. That's the farthest they're willing to go. They don't accept the realities of the modifiability of aging, the reality of biological immortality, and the entire premise of everything I've said to you for 5 years, that the core scientific and technological transition is a focus on immortality, biological immortality, not mythical immortality, but animals that can live forever, given good conditions. And ideally, you will become one of those animals that can live forever, given good enough conditions. Okay, let's get deeper into the heart of darkness. What does your sad physician actually believe about aging-associated diseases like heart disease, dementia, low-grade depression? They were taught in medical school that those diseases are due to a handful of pathways and risk factors. Pathways and risk factors developed primarily in the 20th century, before we actually knew all of the genomic and other omic foundations of health and disease. And in almost all cases, they're not reading the current literature, and their knowledge is antique because almost everything about our knowledge of these things has been radically transformed just in the last 10 to 15 years. Almost nothing they learned in medical school is generally or scientifically true. It is sometimes accidentally true. It is sometimes coincidentally true, but it's not actually well-grounded in what we now know about biological science. So what is the reality that step 3 is going to be based on? The reality is that except for a small fraction of diseases, which are indeed due to single genes, they're called genetic diseases. Other than those genetic diseases, the machinery of aging is complicated. The genetics of aging are complicated. All the metabolic foundations are complicated. Most stories that you're told about aging at most scientific meetings about aging aren't true. And they're being progressively swept aside, particularly by genomics, which is showing in a very straightforward and powerful way that the simple stories of 20th century reductionist biology are not true. Given this complexity, what the hell? What are we going to do? Okay, this is complexity beyond the capacity of a single human brain to absorb all information and spit it out and say, take this drug, which is literally what your physician is supposed to do. So in a sense, let's be compassionate. Your physician is trained to do the wrong things. It's not their fault. To do the right things is impossible for a single physician. The only thing that will get us through step 3, where the true complexity of aging and its diseases faces us with every visit to our physician if we're over 50, and I'm way past 50, the only thing that will save us is artificial intelligence. So for artificial intelligence, it is in fact easy to look at 100 sites in the genome which might influence the progression of your heart disease. And in fact, this would be 100 or 200 locations in your genome, which could determine your risk of heart disease and suggest which medications you should in fact take. No physician known to me is now doing this. Many physicians will be doing this come 2030. I don't know how many. How many physicians are going to be doing this is a function of the politics of the practice of medicine and the hold of cell molecular reductionism on the curricula of medical schools. So it's going to happen. This is literally the work that myself and many other people are now engaged in. dealing with reality, not the fictions that we got from the 20th century, but the reality of the complexity that we need to master to get to step 4. Step 4, where we're really in control of things. Things are moving really fast. Things that I might have said or thought 18 months ago, I no longer believe. And almost every one of those changes has been for the better. Very, very rapidly, in a way that's really blinding. We are progressing away from the falsehoods, the misconceptions, the hopes, the dreams, the fantasies and confabulations of 20th century medical thought about aging into a completely different world where we can see everything thanks to tools like genomics, and we can parse everything. We can parse the complexity. We can make sense of it, and we can convert the complexity into really good medical decisions. That is the ripe core of step 3. That is what's going to happen at software speeds. So it's going to be more like, the development of the iPhone than anything else you've experienced in your life. Remember, 20 years ago, what did we have? We had flip phones, right? We could make phone calls from everywhere. We thought that was fantastic, right? What have you got now? Well, almost all of you have a supercomputer that's the size or a little bit larger than your old flip phone. That is fundamentally what's going to happen in this decade. Back to your sad physician. Your sad physician is going to be clinging to conventional medicine. They're going to be clinging to what they were told in medical school before 2008, 2010. And they're going to be getting continuing medical education, CME credits, which they have to do. It's a condition of keeping their license. And slowly, possibly, those CME credits might contain modern 21st century content. And slowly your physician might become your ally. Might. Depends on how open they are. But in the 2030s, your physician will no longer be sitting in the office with you, scratching their head, trying to remember what they learned in medical school about treating your chronic depression, your hypertension. The world will be completely different. It will be transformed by genomics, AI, also called machine learning. If you ever wander into the AI world, they're coming to rescue medicine, to rescue your physician, okay? And fundamentally, to rescue you. There's one last thing I want to say about step 3. And not only is your standard sad physician trained in a whole lot of things that aren't true, they don't really want you to get too involved in your own health management in many cases. This is the older generation of physician. The younger your physician is, the less likely this is true. One of their biggest problems, if they're an older physician, is that it's just damn confusing when a patient confronts them with 3 or 4 ideas that the physician has never heard of before, because they certainly weren't talked about in medical school up until the last 10, 15 years. So they sort of want you emotionally and understandably to be a lamb to the slaughter of 20th century medicine. Okay. What do I think you should do? I think you've got to be fundamentally involved in many ways rebellious, not stupidly rebellious. We saw enough of that during the pandemic, but thoughtfully involved, in a sense, charitably toward your sad physician. Your sad physician is sad in both senses of the word sad. It's very sad for them to not understand what's going on in the world. They weren't trained to deal with it. Okay. Now, almost none of you are trained to handle the change in genomic complexity of aging and the revolution that is step 3. My hope is that over the next 10 years, People Unlimited will do their very best to keep you involved. If you're a member of People Unlimited, I hope that you're in effect going to be emotionally supported and counseled to deal with this revolution. Because if we can get through step 3, what's on the other side is amazing. Okay? This decade is going to be a wild ride for you and for your physicians. Nobody right now can predict just how amazing medicine is going to be in 2030, in which particular ways. But there's nothing stopping this revolution. It is impossible to stop, even though the cell molecular reductionists don't want it to happen. Okay, because it means abandoning all the beliefs they have clung to, especially since they first heard Aubrey de Grey speak. Unfortunately, that's just not remotely enough. It's like 100-fold not enough. Because the point is, if you can survive step 3, you get to step 4. Now, I'm just sort of going to go a little off script here. If you could survive to 1945 in the 20th century, if you didn't die of sepsis in an operation that went badly wrong in 1932, before civilians were given access to penicillin. If you made it to 1945, they released penicillin and started giving all kinds of people antibiotics. They used those antibiotics to wipe out diseases like syphilis, gonorrhea, but more importantly, tuberculosis. Up until the 1940s, there were large sanatoriums that warehoused people with tuberculosis. I had a great uncle on one side of my ancestry who died of tuberculosis, and on the other side, a great aunt who died of tuberculosis, both in their 20s. Many of you don't have any living family members, living family member memories of the deaths that tuberculosis used to cause. Pneumonia used to kill a huge fraction of people in their later ages. Okay, pneumonia was called the old man's friend because it enabled them to die quickly and easily. Okay, but if you made it to the late 1940s, you had antibiotics to hold those diseases at bay, to wipe them out. If you made it to 1990 with the proliferation of antivirals, you could survive HIV. For that matter, you can survive COVID if you take Paxlovid, which is a combination of 2 antiviral medications. Okay? If you can just make it through the next decade, what we're then going to have will be completely mind-blowing. But right now, it's like getting through the period from like 1933 to 1945. When, you know, your best defense against infection was vaccination. Your best hope of surviving an operation was if the operating theater was sterile enough. And most importantly, that you and your physicians washed your damn hands. Okay? So step 3 is confusing. Step 3 is we know the general outlines of it. We don't know the details because the details will be supplied to us by artificial intelligence. These details are beyond the scope of the individual human mind. And once we get through step 3, thanks to the artificial intelligence, we will know exactly what to do to basically obliterate aging and set the vast majority of us up for indefinite lifespans for biological immortality. Thank you.
Michael, that was great. Thank you very much. Wow, really enjoyable to hear you, and you look great. You look.
Thank you.
Yeah, yeah. So thank you so much. I think we have a few comments here that,
Yeah,
or maybe a couple questions if you don't mind.
We have time for a few questions. I know we all missed those. We all missed those slides that we couldn't understand at all. That might be used to us because we could just project whatever we wanted upon them. But does anybody have any? Well, I'll just ask you, Michael. I mean, we had a physician here. Was that yesterday? Yeah. Who was talking about transcriptomics and transcriptomics. And actually, we have somebody speaking on that. Is it on Thursday? And so, but my question is sort of, where is this revolution? So I think this guy's great. His name is Jeffrey Gladden, and he's super comprehensive relative compared to some others we've seen, and very exciting in that way. But where do you see this revolution sort of poking through now, currently?
So it's already happening inside pharma companies, actually. It's the AI tools are already being used to develop diagnostic tools. And so that is what is happening right now. And there are companies right now that are already marketing AI developed diagnostic tools for, I'll give you a concrete example, for taking a sample of your blood and determining whether or not you have either a particular kind of cancer or in some cases, many kinds of cancer just from a blood sample. You actually had somebody talk about this at RADFest.
That's right.
Yeah.
Yeah, that's right.
He was talking about identifying from blood samples the earliest stages of the development of cancer. That's already happening.
Right.
So that's been in motion for the last 5 to 8 years.
Yeah. And where do you see, so I'm just trying to bring this sort of down to a action level or pragmatic level. So we get the action part that we should eat more according to our ancestors. And what about the sort of programmatic longevity, other like treatment level? Are you like not, are you like,
so as I said,
are you opposed to that?
No. I tried to address it. Let me try to make it even more clear. Your SAD physician wants to treat your aging diseases that are due to your being a SAD person, a standard American diet person. The solution, the really good solution, is to stop eating the goddamn standard American diet.
Yeah, we got, right.
Yeah, so that's step 2. Okay, so today's talk is really not about that. Today's talk is about your relationship with the medical care system. So right now, the best pieces of the medical care system are just now getting tools like the AI created blood diagnostics for things like cancer. And, you know, I personally know the people involved in that part of the revolution, and they're going after all kinds of other things as well. So to be very concrete, instead of your physician like putting his hands in all kinds of awkward parts of your body, hello, prostate cancer. Your physician can do really good blood tests. Now, some of you may have heard of PSA, prostate specific antigen. It's not actually good enough. It's not actually specific enough. It's not actually indicative enough. It's a good try. But more and more, your blood tests will be showing your physician more and more. So, I'm one of these goofy nerds who reads like the 6 pages of printout from a blood test. And being a research biologist, I know that most of the things they're testing for are based on medical research findings that are 30 to 80 years old. Okay. But blood tests are going to be moving very, very fast this decade. Another thing that's moving very, very fast that many of you had experience of is imaging. That means MRIs, CAT scans, PET scans, and so on. Those were pretty crude instruments before the advent of AI. AI can take the information from those kinds of scans, assemble it all, and really make good guesses about, where you have a tumor in your body and how dangerous it is. That's a second concrete example, is imaging is going to be revolutionized by artificial intelligence in this decade. So, before the genomic revolution of about 20 years ago, we had all these very crude, very simple blood tests that we could do, which would reveal like pre-diabetes from your blood glucose level, your blood sugar level. Over this decade, the blood test will become a spectacularly powerful tool of diagnosis.
That's exciting. Yeah. I think we all know the experience of kind of having to take what doctors tell us and what they tell us about our age and filter it in a way and try to benefit what we can from them, knowing that there's this sort of hardcore bias against us. So I think we can all relate to that, right?
Yeah.
Yeah.
Well, I mean, I think I said to someone who asked me about this talk that in some ways it's going to be like marriage counseling or the relationship you have with your physician, right? Your physician does not understand that most of you have an emotional commitment to immortality, right? And in terms of all the training they got in medical school, they have no belief in the scientific reality of immortality because they just weren't told. Okay. So, be kind to them. They know not what they do. I think that's in the New Testament, right? This dude Jesus said that about the Romans, right? So, your sad diet physician, Roman centurion. Did the Roman centurions know what they were doing? No. Because, the whole biblical religious tradition, it meant nothing to them. It's like weird stuff going on in Palestine. Does your sad physician understand you, the revolution that they're living through, and what's on the other side? No. They have no idea.
I don't think our naturopathic doctors know either. I don't think I think they have the same, they have different tools, better tools in many cases, but I think they have that same, as far as the foreignness of unlimited lifespan, I think they have that as well.
Yeah, I mean, and remember, they're just professionally completely lacking in any commitment to human indefinite lifespan, right?
Yeah, yeah. They're actually offended by it in many cases.
Yeah. Well, Sure. I mean, I have to be very careful when I talk to physicians. You can't imagine. Uh, so, I mean, in my case,
But are
having
you
all the,
careful?
excuse me,
I said, but are you careful?
I am, because I don't want them to get angry and deny me medical care. Come on. I mean,
E-
we
e-
all need a good physician.
yeah, even to that point, Joe, I feel they're also offended by artificial intelligence. A lot of the pushback that I've been seeing, especially from the medical field, it's that, how can you replace doctors with years and years of training with this machine thing? And so there are a lot of the medical field is pushing back on artificial intelligence. Meanwhile, there are all these other medical institutions that are already using artificial intelligence for diagnostics and getting like close to 90% accuracy. I saw actually a cancer school in Canada that's already using it for diagnostics, and it's close to 90%, like 5 to 7 years ahead of any doctor being able to catch it in like regular imaging.
So if I may revert to my, knowledge of the history of medicine, between like Louis Pasteur did all these beautiful experiments in about the 1860s, early 1870s. And, he'd lost two daughters to infection, which he realized didn't need to have happened at all. And he became an absolutely determined crusader for the microbiological revolution in medical practice. And the medical establishment of his day hated him, hated him. And he only got a few converts at first. And of course, mostly in France, because, the French, they'll love something if it's French before they'll love anything from anywhere else. And the English are exactly the same thing about English discoveries, meaning from England. So imagine how weird it was to be a patient who read about Pasteur's research in the 1780s. Sorry, I mean the 1880s, or the 1890s. Imagine having a conversation with your surgeon who didn't think he needed to wash his hands before he operated on you or sterilize the surgical instruments. Imagine how weird and freaking intense that must have been. Okay, that's the moment we're now in. That is, your life is on the line. Your sad physician might be endangering it by giving you the wrong medications, by giving medications that might make you feel better for 5 to 8 years, but for example, destroy your brain. Like any primary care physician who gives you benzodiazepines, which is like a prescription for dementia. Okay, might make you feel less nervous and anxious, but 15 years later, you won't remember the names of your children. Okay, I mean, all our lives are completely on the line here. All right.
Yeah, that's
We
right.
need access to medicine. We just need the medicine we're going to have 10 years from now. The sooner we get it, the better we will be.
Yeah, for sure. Super. Thank you so much, Dr. Rose.
Thank you.
Okay.